Hi everyone. So today we're going to talk about UTI, urinary tract infection. A lot of people suffer from UTI at various point of times. Now, women suffer 4 times more than men when it comes to urinary tract infection. Today we're going to talk about what urinary tract infection is, how does it impact, what are the symptoms, and how can we really work towards it, towards improving the recurrence of it. Now, urinary tract infection is basically an infection which happens in your urinary tract, starting from kidneys to ureter to bladder to the urethra. Yeah. Now, there's a certain bacteria, E. coli bacteria, and in that specifically uropathogenic bacteria is what causes urinary tract infection. Now the bacteria enters through the urethra and goes into the system, and the infection takes place. Now, because the entrance is from urethra, the manifestation happens in the genital areas. And if you overlook UTI or if you take it lightly, it can have severe repercussions in terms of kidneys getting affected, in terms of your whole immunity system going down. So one needs to be very careful. If you're seeing recurring episodes, you cannot take it lightly. You need to really take measures so that you're not getting the repeated episodes of UTI. Now, what are the symptoms of UTI? There will be burning sensation while urinating. There will be itching in the urinal passage, in the genitals, frequent and urgent urge to pass urine, even though when you actually go, you're not able to really pass out, large quantities of urine. The urine color will be dark. They can be bloody urine. They can be cloudy urine. It can be a very strong smelling urine and foul smelling urine. You could have pelvic pain, you could have low abdomen pain, you could have back pain. Now these are the symptoms that one experiences. Yes, in severe cases there can be fever with chills as well. Now, how do we identify? A simple urine test, a urine routine test will identify if you have UTI, and then of course the doctors may ask you to do a culture to see what bacteria, what antibiotics are you resistant to. Of course the treatment is antibiotics, but the other way to really deal with it is to through the dietary interventions. So I'm going to talk about few things. If you start doing that, it is really going to help you to not have repeated episodes of UTI, and even when you have UTI, it is really going to help you to get over it. Now, number 1 is drink more and more water. So in a normal day, let's say if you're drinking 3.5 liters of water, maybe have about 5 to 6 liters of water. One, because it's going to flush out the bacteria when you pass out urine, and it will keep you hydrated as well. Also have a lot of vitamin A rich food and vitamin C rich food. Vitamin A for your immunity, and C as well for your immunity. Also vitamin C, as we all know, is ascorbic acid. It also makes your urine acidic, and the bacteria dies out in that acidic environment. Yeah. The other very important thing is to have zinc rich food. In fact, there was a research that was published by the Queensland University, which clearly said that zinc can actually be used as a non-antibiotic UTI treatment. So zinc is very, very important. And while you're taking zinc, you must make sure that you're also taking copper rich food, because zinc tends to deplete the copper amount in your body. So make sure that you're taking zinc rich food as well. Leafy vegetables, because that will give you vitamin C, iron, zinc, all of that. So make sure that you're using leafy vegetable. Barley water works extremely well. So you could take about 50 grams of barley, boil it in 2 liters of water and just drink that water. Yeah, that's going to help you a big way when you have UTI. The other very important thing is cranberry. So you could get a cranberry extract or a cranberry juice. In fact, a lot of medicines that come for UTI have cranberry extract in them. So make sure that you're using cranberry juice or cranberry extract. Also make sure that you're using probiotics in the form of yogurt or any other probiotic like a fermented food, buttermilk, curd, anything that you think is available in your environment, because that's what is going to give you good bacteria. Now, when there is good bacteria, it will fight out the bad bacteria much better. Yeah, so once you add all of these, it is really going to help you to come out of the UTI episode. Also, this is a short-term thing when you have the UTI episode going on. In the longer term, make sure that you have a very strong immunity, and thereby you are not able to. The bacteria is not able to kind of attack you often. Why does it happen? Now there are various theories. Yeah, so various points rather. So people say during menopause the skin becomes little thin, and thereby E. coli is able to attack. Sometimes it could be personal hygiene, sometimes it could be frequent intercourse. So there are various reasons. But if you are able to take care of your immunity, the recurrence will definitely come down. Coming to the treatment, when I said antibiotic is the treatment whenever you go to a doctor, yes, antibiotic will treat it, will kill the bad bacteria, but along with it, it will also kill the good bacteria, which is what we don't want. Because once, of course, the current episode of UTI is taken care of, but it has caused many other issues because the good bacteria is also killed in the process, right? So antibiotics will not be able to discriminate between the good bacteria and bad bacteria. It just kills all the bacteria. So if you're able to work on your immunity in the longer run, you will definitely see a much better improvement. So go ahead and start using barley water, cranberry, vitamin C, vitamin A, zinc rich foods on an ongoing basis if you are someone who's been having these recurrent episodes. If you have any more questions, do get back to me through the comment section. Don't forget to like, share and subscribe. We'll talk again. Bye-bye.